We are going to talk today about pornography addiction.
What I think a lot of people don't realize, if you're not really studying or into the neurobiological aspects of it, is there's tons of stuff happening at the brain at the same time that gets you to the place of wanting porn, enjoying porn, and needing more of it. So what happens here? So you have norepinephrine goes up, right? And what does that do? It triggers your fight, flight, actually, or freeze response. So physiologically, you start to get excited, right? Blood flow, heart rate, enthusiasm for whatever you're doing. And then as Greg pointed out, you've got this dopamine burst, right? This feels good. I want more of it. Focused, it's very important to talk about focused attention, because there are people who, as we will talk, spend hours and hours and hours looking at porn. Sometimes they edge, which means they'll just masturbate, but not have an orgasm. Because the experience, the physical sensation, and how they are sucked into that pornography, they don't want to give it up. They want to see how long they can keep this going. And then you have the drop in serotonin, which is what also keeps the libido going up, right? So you've got these things going, you've got up, and down. And that we see a lot of sex addicts and certainly porn addicts who have mood disorders. There is correlation with OCD because sex addiction, it's a compulsive behavior. We see people with anxiety, generalized anxiety disorders. You see people with agoraphobia, right? So I'm living in this little world. Or depression, and we know depression and anxiety are two sides of the same coin.